One of the most persistent myths in healthcare is that chiropractors cause strokes. It's a claim that has been repeated for decades in news stories, online discussions, and even by some healthcare professionals. If that claim were true, it would be a serious concern and deserve serious discussion. But when researchers actually investigated the issue, they found something very different. Here's what most people, including many detractors of chiropractic, don't know. One of the earliest symptoms of a vertebral artery dissection, a rare event that can lead to stroke, is often sudden neck pain or headache. Sometimes these symptoms appear hours, days, or even weeks before a stroke occurs. Now take a moment to consider that. If someone develops a sudden neck pain, what are they likely to do? They're going to seek care. Some will go to a chiropractor, some will go to their primary care physician, some will go to urgent care. Some will go to the emergency room. Now imagine someone develops crushing chest pain and goes to the emergency room. 2 hours later, they're diagnosed with a heart attack. Nobody concludes the emergency room caused the heart attack. The heart attack caused the emergency room visit. Yet, when someone develops neck pain from an evolving vertebral artery dissection, sees a chiropractor, and later suffers a stroke, many people immediately assume the chiropractor caused the stroke. That's not science, that's confusing correlation with causation. And that's exactly what researchers decided to investigate. One of the largest and most important studies ever conducted on this topic was published in the journal Spine in 2008 by Dr. David Cassidy. Researchers examined millions of healthcare records and looked at patients who experienced vertebrobasilar stroke. What they found was remarkable. Patients who later suffered these strokes were just as likely to have visited a medical physician before the event as they were to have visited a chiropractor. But researchers didn't stop there. Even if patients were already developing dissections before seeking care, another question remained. Could the physical forces of a chiropractic adjustment actually be enough to damage a healthy vertebral artery? That's where the work of biomechanics expert Dr. Walter Herzog becomes important. Herzog and his colleagues measured vertebral artery strain during cervical manipulation and compared it to normal neck movements. What they found was surprising. The vertebral artery experienced less strain during a manipulation than during many ordinary movements people perform every day. In other words, the forces involved in a properly delivered adjustment did not appear to place the artery under uniquely dangerous mechanical stress. So now we have two separate lines of evidence: epidemiological research suggesting patients were already developing symptoms before seeking care, and biomechanical research showing that cervical manipulation does not appear to subject healthy vertebral arteries to extraordinary strain. Neither finding proves risk is zero, but both findings challenge the simplistic claim that chiropractic adjustments are directly causing strokes. Think about the implications of that for a minute. If visiting a chiropractor causes strokes, why would we see the same association with medical doctors? The answer is that patients experiencing the early symptoms of a vertebral artery dissection seek health care before the stroke occurs. The neck pain brings them into the office. The office visit doesn't necessarily cause the stroke. The underlying arterial problem is what caused both the symptoms and the healthcare visit. This is one of the most important lessons in medical research. Correlation does not equal causation. Now, does that mean chiropractors get a free pass? Absolutely not. Good chiropractic care requires excellent clinical judgment. It requires proper screening. It requires recognizing red flags. If a patient presents with sudden severe neck pain, unusual headache, dizziness, visual disturbances, neurological symptoms, or other concerning findings, those signs deserve careful evaluation. It also means using sound clinical reasoning and selecting the right technique for the right patient. Modern chiropractic care is much more than one type of adjustment. Today's chiropractors may utilize manual adjustments, instrument-assisted techniques, mobilization, flexion distraction, soft tissue therapies, rehabilitation exercises, and other modalities and approaches based on the individual patient. The goal should never be forcing every patient into the same treatment or making as many or as loud a cracks as possible. The goal is delivering the safest and most effective care possible. So what does that evidence actually say? Current research does not support the claim that chiropractic adjustments cause vertebral artery dissections. What the evidence does support is that patients experiencing the earliest symptoms of a rare arterial dissection often seek healthcare before a stroke occurs. That's a very different conclusion. The lesson isn't that risk doesn't matter. The lesson is that causation matters. And as healthcare professionals, we should always follow the evidence, even when it challenges long-held assumptions.